Hi, I'm Dr. Mura. So thank you so much for joining us again as I share my experience and how I'm doing after discovering that after testing positive to COVID-19. Yesterday we did a positive video just, describing how almost everyone in the family has been affected, and I also highlighted certain things that those of us who have come down with this COVID-19 can do to stay safe, and but also to prevent ourselves from infecting others. If you'd like to have a look on that, you can find that on our Facebook webpage, our Facebook page, and to learn more about that. But today, I came in again to say how me and my family are doing, and also we're going to talk about how to boost our immune system to combat COVID-19. You see that I put in inverted comma because you will see why in a minute. So yes, we want to thank you so much for overwhelming response, the people wishing us well, praying for us. We really, my wife and I really appreciate that, and we are doing well. I'm still doing fine. I have yesterday just had a little bit mild headaches, which got better with the rest, but otherwise nothing really major, and I'm very thankful for that. The rest of my family, they're all doing well as well. Yeah, so let me quickly go to it. This won't be too long. Please watch it till the end, and please, if you find this very helpful, please share this video so that other people can learn about this, so that we all can be safe. Yeah, so when people often ask me how can I boost my immune system to boost immune system to fight COVID-19, either those who have infection already, those who are trying to prevent it, often what I think they're also saying without even verbalizing is that those who have succumbed to this disease, or those who severely get affected, is because they have a weaker immune system. And I'm always reluctant and cautious to assume that, and here's why. Yes, we know that elderly patients or elderly people are susceptible to severe COVID-19 disease, but on the other hand, not the children. Okay, so then are we saying that immune system of 1-year-old child is stronger than that of 67-year-old? Not necessarily. Yes, obviously we know that elderly patients have a decreased immune response to infection, but we also know that young children have immature immune system, and they often suffer from common viruses, including flu, but not necessarily against COVID-19. So yes, immunocompromised people we end up suffering from complications of respiratory related complications, but again, not necessarily COVID-19. And you might have read in a paper, there was this article published in a Swiss medical weekly. You can actually read this for free or online, where there was this couple who come down with the COVID-19. This couple, husband and wife, 60-year-old. They started with the difficult breathing, fever, symptoms in keeping with the COVID-19. They rushed to the hospital. They were both admitted, but what happened is that the wife was immunocompromised. The wife had been taking chemotherapy for her recurrent breast cancer. The husband, on the other hand, was immunocompetent, didn't have other issues. But what ended up happening, the wife who is immunocompromised, she actually did better. Day 6 she was discharged, and she didn't require intensive care, while the husband, who's immunocompetent, didn't do well. The husband ended up in intensive care unit, and he had a very slow recovery. Thankfully, he also recovered. But basically, the wife was immunocompromised. They seemed to do better. And you're wondering, how can that be? You see, when it comes to unlike common viruses, COVID-19, so far, what we know so far, have not been shown to cause more severe disease in immunocompromised patients. So we find people who have come down with COVID-19 like us, some of them end up becoming severely affected because actually our immune response reaction towards that COVID-19. So what happened is at day 7 to day 10, our immune system just amount cytokines storm reaction response. By the way, cytokines is part of innate immune system. By the way, don't miss tomorrow. Tomorrow I'm going to be talking about how immune system respond against the viruses. Yeah, so cytokines storm are just amounted in the body. It's more like autoimmune response that it really happen. Basically you have the body over the immune system over reacting, trying to kill coronavirus. In doing that, basically our lungs, tissues becomes collateral damage, and that's basically what has been shown. So, we're to say that those are weak immune system, they are the ones suffering more from COVID-19 may not necessarily be true. That is why in a severe complication of COVID-19, now as a doctor, some medical authorities actually use some immunosuppression to be able to give the body chance to recover, to prevent the body attacking itself. So what happened on the first stage of infection, you have basically the virus is causing trouble in your body. But on the third stage, that's basically our immune response that's actually more detrimental to our own cells, to our own body, and we end up even getting sicker in that way. So having said that, am I saying that we shouldn't do anything to arm ourselves against infection? No. By the way, remember, yes, we're talking about COVID-19, but there are other infection, viral infection that we have to arm ourselves about. It's not only about COVID-19. So yes, nutrition, health and nutrition, or optimal health and optimal nutrition status is very, very important in this to prevent ourselves against viral infection. And that's what I personally recommend. That's what I'm practicing, just a health balanced lifestyle, basically including sleeping 7 to 9 hours, including staying active, including staying in contact with your family, or being a bit virtually now since we are isolated. Eating health food, recommending definitely a diet centered around whole plant foods, and that's what we recommend at Dr. Mura Health, and we'll talk more about that. By the way, that's what the WHO recommends as well. It recommends eating fruit and vegetables, eating legumes such as beans, split peas, lentils, and so on, eating whole grain, basically eating nuts and seeds, and cutting down on junk food, cutting down on sugar, cutting down on meat, cutting down on salt, and so on. And this is basically, it's a holistic, balanced lifestyle. So yes, there are certain things that in the study, there are certain food that have been shown to improve immune system, combating some viruses, common virus, and so on. And we talk about that. But generally, it's when you go in, it's a whole full plant-based lifestyle, basically, that's going to equip us. We don't want to improve, boost a certain immune system, that especially that may actually make things worse. So when it comes to COVID-19, for somebody who gets sicker, may rather be a dysregulated immune response to that infection, not necessarily that we have that they have a weaker immune system. Yeah, so I hope that helps. That's it. That's it for now. And tomorrow, I say we're going to be talking about how immune system responds to viruses. And by God's grace, I'll going to be there. And see you soon. If you think this is helpful, please share. And may God bless you. Bye.